I'm Sonia Goins. Crohn's and colitis are considered inflammatory bowel diseases. 1.6 million Americans are affected by the conditions. Joining me now is Dr. Sundeep Arora with Minnesota Gastroenterology. Thanks for joining us.
Thank you for having me.
Yeah, so you mostly work with pediatric patients, right?
That is correct.
First of all, can you explain what is inflammatory bowel disease?
So inflammatory bowel disease, or IBD, is basically a chronic, that is a lifelong inflammatory condition that can present either as Crohn's disease or ulcerative colitis.
Now, is it hard to diagnose young people?
Yes, sometimes the symptoms of inflammatory bowel disease may not be the textbook or the classic symptoms, as we say. The classic symptoms, of course, would be like having abdominal pain, diarrhea, blood and mucus in the stools, losing weight, not growing very well, those kinds of things. But oftentimes they could be so subtle that it may not be brought to the medical attention. Unless you are paying close attention, for example, a child who has not been growing for a while or who has been becoming pale over the years, then you would kind of miss the subtle clues that would go in the direction of Crohn's or colitis. It is widely understood that there could be a delay of anywhere from 6 months to 2 years from the onset of disease to the diagnosis that is made.
I know, and then for parents, I mean, this has to be confusing. How do you know if your kid has like something as simple as like, IBS as opposed to inflammatory bowel disease or like a flu bug? What would you tell them? What's the difference?
Oftentimes, having a flu bug would have symptoms that should resolve over a period of time. But if you see that the symptoms have resolved and they come back and they come back, and over a period of time, if you put all the times together, you would see that something is not right. For example, a child who used to be so active once upon a time has now become so tired, is lethargic all the time, would rather stay homebound and not go out and play with your friends, who's been losing his appetite, who's just been complaining his joints have been aching. There have been some low-grade fevers even though nobody in the family has been sick, like 99 to 100 fever, is complaining of canker sores in the mouth, having night sweats. And all of a sudden you see, wait a minute, this child is not growing. I mean, he's not eating as well as he used to be. His joints have been aching. So these are the kinds of symptoms that you're looking for that could be much earlier than the classic presentation, like having diarrhea or cramping pain or losing a ton of weight.
Well, and I know earlier you were saying that kids are being diagnosed at really young ages now.
That is correct. So previously we were taught that Crohn's disease or ulcerative colitis could present in teenage years or when you were between the ages of 40 and 60. But now we are seeing much and much younger presentation, kids who are like 2, 3, 4, 5. So it can present at any age actually. The foundation for the disease is kind of laid at birth. So either you have genetic mutations or genes transmitted through the generation, or new ones may have developed when you were being conceived.
Wow, so there is no cure for Crohn's or colitis. So
that is correct.
You can only manage the symptoms. How do you manage the symptoms when it comes to pediatric patients?
So the important first thing is to make sure that we have the right diagnosis. So when you go to see a pediatric gastroenterologist, we take into account the symptoms, do some laboratory testing, endoscopy, colonoscopy, and once we have confirmed then this is a diagnosis, then we sit down with the families and then discuss various treatment options. The important thing to understand is that even though every patient may have the same diagnosis, they do not have the same disease. So you have to tailor therapy to individualized patients. And there are multiple different options. So there is enteral nutrition, there is coating medications, some brief role of steroids, immunosuppressives, biologics. So depending upon how your disease presents, what kind of aggressive nature you have to the disease, we sit and have a discussion about that.
Well, I know you told me something interesting while we were talking before the show, that you're no longer going with steroids as the first line of defense in treating this.
Yeah. Since the inception of the first biologic around 1998, that was infliximab or Remicade, the treatment options have been mostly non-steroidal and focusing on mucosal healing. And since then, we have a lot of biologicals which have been targeting the TNF-alpha pathway and the non-TNF, the non-classic pathway, along with other medications. But yes, steroids are only used briefly just to induce some remission, and only when you have intermittent flares, that is exacerbations of the disease. They are no longer used for maintenance treatment.
I have to ask you, I mean, if I was a parent and someone told me, hey, my kid has Crohn's or colitis, I'd kind of freak out a little bit. What do you tell parents?
We tell them that this is a chronic or a lifelong condition. It is very, very treatable now. And the real scare comes from the fact when people go on the internet and they look at the steroid side effects, they really get scared and they are worried that their child might end up being on steroids for the rest of their life. Also, some of the medications like the immune suppressives can also have some side effects. So the best thing is to sit down and have a discussion as to what exactly are the goals of treatment, what are we trying to achieve through it, what would happen if we do not treat the condition. So there could be some complications. So depending upon that, then we devise a plan which is kind of suited or tailored to your needs. But it's definitely quite a devastating experience for a lot of families when they have the first diagnosis, yes.
Right, and how do you even treat a patient as young as 2? I mean, can you do a colonoscopy on a 2-year-old patient?
Yes, we can do colonoscopies in younger patients, yes.
Wow.
And we do biopsies. So, and these biopsies are then what help us making a diagnosis along with the symptoms and the lab tests.
Well, you don't treat infants with the same drugs as adults, do you? Or how would you treat like a 2-year-old?
Sometimes even 2-year-old children may have either diseases which are equally aggressive or more aggressive like adults. So yes, often we have to use biologic medications like Remicade or Humira even in young children.
Wow.
Yeah, just because the pathophysiology of the disease does not change much in children who are younger or in older adults. And as I said, sometimes it could be even more aggressive.
Right, and there are no there are a lot of things that can contribute to this, like the environment, your diet. What are some other things that can attribute to inflammatory bowel disease?
So the basic 3 things would be the genetics, that is the genes that you have acquired or new ones may have happened, the dysregulated or an abnormal immune response, and some kind of a trigger. The trigger often is the normal bacteria that reside in your colon. So your immune system should not be looking upon these bacteria as being something foreign or something harmful. But because of this genetic background, your immune system gets dysregulated. It begins to look upon these bacteria and mounts an immune response specific to your gut, which kind of initiates the chronic or the lifelong inflammatory process. So we do not fully understand what this trigger might be for different individuals. And there are lots of gaps in knowledge, and that's what we are trying to understand about the disease.
Anything on the horizon as far as treatment? Do you see any new treatments coming out?
The new treatments right now are mostly focusing on the non-TNF alpha. So TNF alpha is the main inflammatory chemical that rises when you have inflammatory bowel disease. And for the longest time, we had medications like Remicade or Humira, but now we are focusing on the non-TNF, like the Entyvio, the Stelara, and some more like etrolizumab, which is coming out in phase 3 trials. So a lot of focus has been happening on these other alternative pathways that could be equally important.
Okay, lastly, what would you tell the general public about these diseases? I know you can't get it, it's not contagious.
It's not contagious, and this is just like any other autoimmune or an immune-mediated condition. It falls in the same category as your lupus or autoimmune hepatitis or those kinds of conditions. So they need to be treated. And with treatment, you can actually have a good quality of life like any other person who did not have the disease.
Perfect. Well, thanks for joining us.
Thank you, ma'am. Thank you for having me over.
Okay, well, we'll be right